Let's get started. So, my name is Xiaoyan Huang, Yale class of 91. Welcome to all of you to this event, both on site. We have close to 20 people, and then so far we have 21 participants online from everywhere. So the topic of our event is called Women in Health, Uncommon Paths. So this event was put together by a lot of people, including Yale Club of Oregon, the Yale Alumni Association Career Life in Yale, which is an initiative to help connecting alumni to students and alumni to alumni. Specifically, the Alumni to Alumni is a new subcommittee and a new initiative that we've been developing here in Oregon. We piloted several events to help connect alumni to alumni. I believe Rob Greenlee is online. He's the chair of the A2A subcommittee. Rob, are you on? Anyway, thank you for your support, Rob. And then first Gen Yale, Lisa Chapman is our Yale Alumni Board of Governors, immediate past chair, as well as the chair of first Gen Yale. She's helped me a lot in terms of event organization and marketing. YaleWomen has been our partner, and also Providence Institute, where I work. So it's really not, I really didn't put this event together very cavalier. This is the intersection of what I do day and night. In my day job, I'm a cardiologist. I work for Providence. I am the medical director of clinical transformation for Providence Heart Institute. I'm president of medical staff at Providence Milwaukee. So in my professional life, we're talking a lot about burnout and wellness. And in my role as the president of Yale Club of Oregon, as well as the executive officer for the Yale Alumni Board, we have also been talking about navigation of career transition, pivoting, particularly for YaleWomen. So I've been thinking about this a lot. Before I go to these four amazing panelists, I wanted to kind of just connect you guys together to each other. So last time I checked, we had 58 registrants, mostly women, including 6 very brave Yale men, one of them being my husband, who helped with the technology setup and bring food and drinks and stuff. So most of us have Yale affiliation, probably only because we've been marketing mostly through the Yale Alumni channel, but also locally. We have a variety of degrees and roles in healthcare. We have RNs, MPs, PAs, MSNs, not PMAs, what is public health? And then MDs. We even have a JD and MBA. And we are in clinical practice or in healthcare management, research, health policy, teaching. We have students who are pre-med, who are in Yale School of Public Health, in nursing. Sorry, I need to look at this chat just to be sure that are hearing us okay. Okay. So, and then we are, we do represent diversity in terms of age, gender, race, geography, our roles, our experiences. And I hope that, our diversity is not only measured in any single dimension. So what are we trying to accomplish here today? Why did I, put this together, get the team together? A few points I've been thinking about. One is healthcare has changed, certainly in my professional life over the last 2 decades, I would say. Really that we've gone from artisan, not partisan, kind of shop, often solo or private practice to practicing much more system-based. EHR dominates our lives. Now technology is a very important part of our lives. And then as a result of that, we see a lot of providers developing this, what I call, and not just other people have called learned helplessness, meaning that I'm a victim of the system, I'm a victim of EHR, I have no control of my life, I have to, do a lot of what they call bureaucratic work. So as a result, according to a New England Journal of Medicine Catalyst, there's a collection of papers on burnout, that burnout affects 50% of physicians, and as a result of that, we cause, effects with our partners, our APPs, nursing staff, managers, everyone. And they also report a third of new RNs in their first year after graduation are seeking a different profession. Mm-hmm. So what do we do, and why are we not able to affect a lot of change? What are the main barriers? Some of the things I think about, there was recently a huge YaleWomen panel that talked about career transition, and you'll see that women, we face a lot of career transition depending on our life stages. In healthcare, particularly, I feel the challenges are that we put in a lot of time and cost in expense into our training, and our role in our profession is so much defined by the letters that go after our names, and we've been trained to, okay, this is what you do after you graduate and you stay there for 20, 30 years. And really, we haven't seen a lot of role models and roadmaps in how to, if I'm not happy, how can I change? If I want more, how can I pursue my dreams? So that's why I want to share the story of these 4 amazing women. So by the end of an hour and a half, what do we hope to accomplish today? I hope that we can learn our panelists' career path and how they've navigated their career transitions. And I hope the audience will be able to share some of your stories through your Q&A toward the end. And I hope for the younger people in the audience that we can instill a sense of hope, that we allow them to discover opportunities for growth, and that we help them find a path for success, and also build a network to enable all that. So with that, I'm going to start having our 4 panelists. We have 2 on-site in Portland and 2 online share their stories. So I'm not going to go into much detail introducing you, because I want you to tell your story. So first we have Dani Bowie, who is a class of 18, doctorate in nursing practice from Yale. So Dani.
Thank you, Cheyenne, for setting the stage and putting this all together. Do you want me to look here? I know. All right. I'm thinking about everyone over here. All right, I love it.
We're savvy women.
It's so fun. It's so fun. That's a great reflection. Yeah, I can see my reflection. This is awesome. So thanks for having me, and excited to be here. And I will share a little bit about my story. And I'm going to try and go through just some defining moments or transition points in my journey. But it all began when I was a sophomore in college. So I actually was going to a school that didn't have a nursing program at the time. I was biology and decided to transition into nursing. And so that was a big transition point because I had to actually leave the college that I was attending. And I applied to nursing programs across the country and got rejected when I applied. And that was really the first of kind of the brain being tested, or that defining moment, like, do I really believe in this call? You know, do I really believe in what I'm choosing to do? And so I had actually gone to a couple different nursing schools to talk to professors to try and, figure, what do I need to do? Where do I need to go? How do I get in? Because it's very competitive at the time. And so I actually encountered one nursing professor at SPU, and she sat me down. I didn't get in, and she told me the story about Joseph. So in the Bible, there's a story of Joseph who was sold into slavery, betrayed by his brothers, went through 13 years of prison, but on the back end, he came out and went into high levels of administration. And he had the dream at a young age, but then, his life changed in a way that looked like the dream was never going to happen. And so that's the story that set the stage for my career. And I was like, I don't know what this means, but it's pretty powerful. So after that story, I got rejected, and I went to community college, and I worked at Quiznos for a year. And then I reapplied to nursing school and got accepted to the University of Portland, and I had a Providence Scholarship. Providence paid for my last 2 years of school at UP, and I had a contract to work for Providence for 3 years, whatever the need was. And so I was very excited for that provision, and once again, I was like, okay, I'm seeing the dream come to pass. So I went through the 2 years of school, and Providence placed me at Portland Providence Medical Center on a respiratory cardiology unit. That's where I met Cheyenne, and actually there's some faces in the audience that are from my beginning stages in my career. And so I worked on 2R. I did 9-hour nights when I first started, and it was quite a challenge, actually. Again, another time, the dream being tested, is this really what I signed up for? Pretty complex patients. And so about a year into practice on 2R, I realized that I really enjoyed system management because I had been working as a charge nurse. And I wanted to move into the ICU, but it just wasn't an opportunity with the contract that I was in, because Providence kind of just determined where you went. And so rather than transition to the ICU, I realized I wanted to go back for more education. And so 3 years into practice on 2R, I went back to my master's in health systems management through Vanderbilt. It was all online, and I chose an online program because I wanted to maintain practice, my connections in the area, but grow academically. And so I did that training degree for 2 years, and during that training through Vanderbilt, I was actually given an opportunity to make some mentors and connections that set the stage for my career. So I went to a professional organization conference, Northwest One, and I was a student at the time at the very end of my program, still working on 2R as a direct care nurse as well. And I saw the CEO of the organization present on stage, and I didn't know her, and I was really inspired by her charisma, her ability to present. And so I went up to her at the end of the presentation. I was looking for a mentor for my practicum through Vanderbilt, and I approached her and I said, hey, my name is Dani Bowie. I'm in the very end stages of my degree through Vanderbilt. Would you mind mentoring me? Ooh. And she said, absolutely, yes. And I figured the worst that someone could say is no, right? So I was like, I'm going to go ask and see what we can do. And so she, her name is Gladys Campbell, and she mentored me in my career as transitioning from direct care nurse to management. And she opened up the doors for me to meet kind of legends in nursing, like Marie Manfey. She set up a new model here. I went and spent some time with her out in Minnesota. And then I worked with Northwest One on their board. They were looking to bring in kind of younger leaders to help sustain the call of nurse executive leadership in the Portland metro area. And so I made connections that way, and then while I was working on 2R, finished my master's, my manager at the time had retired. And so I just finished my degree. There was a manager position in front of me, and I actually turned it down. I was like, I don't want this job. Providence told me where I went the first time, I'm going to choose. And so I kind of interviewed all over the country for different roles. I came back to the management job on 2R and realized that it was a really great opportunity to grow as a new leader. I didn't have any management experience, actually. So I was buddied up against, you don't have any experience, you have your degree, but how are you going to break into this new world of management? And so I decided to come home, apply to the job on 2R, and contended for it. There was other applicants, and got the job, and transitioned into management at a very young age with a team that knew me as a student nurse, right? And so I was like, this is kind of a challenge. How are they going to now see me as a leader versus a peer or an emerging nurse? And so I took the job because I believed in it. It wasn't like I just need a job to get the title. I really felt called to that role. And when I entered into practice on 2R as a manager, we were experiencing a challenging patient situation that I didn't have any guidance in how to handle that situation. And it was complex. My team was very distraught by it. And I kind of came to the challenge realizing like I'd rather go down trying to take on a giant situation and stand on the sidelines, too afraid to address the problem. And so I was like, I'm going to just take it head on. I'm going to see if we can develop some creative solutions, work with the team, and help build a strategy in dealing with what we were going through. And we were able to overcome the situation through time, and that really was a defining moment for me as a leader to gain the trust of those that I worked with in one capacity, and now I was working with them in a new role. And so through the success of that and the team moving through that whole situation, I was able to transition into leadership. And the team that I was leading actually had quite tenure. So those that were at my management team had like 32 years of experience to 25 years of experience on that unit. And I was 28 at the time. So it was fun. So after about 2 years on 2R in management, I realized I had outgrown the role. But again, I was facing the challenge of people being like, you don't have the tenure, right? You don't have the years of experience. You need to be a director if you want to advance into hospital leadership. And so I just kept facing this like challenge or statement of like, you don't have. And I was like, well, I feel like I have things. I just haven't been given the opportunity. And so moved outside of Providence and started again reviewing where do I want to go work, what do I want to do, and through my professional connections and organization, I met my future boss, and I had talked to her about what I was experiencing, and she had proposed a new role to me with Legacy Health System. It was an enterprise-wide role where I'd be overseeing staffing and scheduling for 8 hospitals, overseeing a large pool of nurses that floated between 8 hospitals, working with our managers, and then leading a whole technology project, so converting them to new staffing and scheduling technology. And I'm all done. Am I done? Because I can tell you, accepted a position. And for the last 4 years, I've been converting Legacy to new staffing and scheduling technology. So it's an enterprise project, 5,000 end users, 126 nursing departments, and converting them to new technology. We did their policies, and then I entered into my doctorate program at the same time at Yale. So for the last 3 years of leading that project, I would travel across the country to Yale and finish my doctorate in nurse staffing and scheduling, and helped developed a predictive model for nurse scheduling, and then with the independent economist, and we have a patent pending for that. So I chose a role that was not traditional. I didn't have the experience, but I had the desire and the passion to go after it, because I can learn from it. So I made mistakes, but I also learned great things through these experiences. And I have now since accepted a position where I'm moving to Cincinnati, Ohio, and I will be the VP of Nursing Workforce Development. for Bon Secours Mercy Health, where we look at all of nursing workforce from 43 hospitals in 7 states. And it's a brand new position. No one's ever done it before. And so I think that's what I would want to encourage everyone with is you don't have to swim in the lanes that people tell you. You can look and see, like, what are the new things that are out there? Where am I passionate in the current work that I'm doing? And can I help create something in that work? And so that's where a lot of my journey was about, finding the passion in the work and, of course, showing up, doing it. But then you can, with technology and the generation that's coming up in the workforce, I think there's going to be a lot of new positions that haven't been created before. And that's the team that I met at Bon Secours. They said a lot of the leaders there have been in healthcare for a while, and they said, Dani, the position you're walking into, these things didn't exist 20 years ago, right? With the mergers that are happening, healthcare reimbursement, things like that. So just encouraging you guys, like, go after your passion, and I think any opportunity that you're in, is there a way that you can help find that passion, where you find it in a way that you feel your purpose and your calling. So, thank you.
Thank you.
Yeah.
We'll come back to you with questions.
Yep.
Excellent. And then next we have Serena.
All right, can you hear me?
Yeah, excellent.
All right. Thanks, Cheyenne. So just to start, I'm very long on my investment in Yale. I'm a Yale college graduate from the class of '99, Yale School of Nursing, class of 2006, and I'm now in my first year as a PhD student back at Yale in the School of Nursing. So I feel as if that paints a picture that things have been very simple and straightforward, and they have not. And actually just this exercise of beginning to think about my own career trajectory and path has been really a very personally rewarding experience. I don't think I've really been tasked to think objectively about the experiences that I've had and how I got to where I am. And the hard thing about telling your own story is, where do you start? And I didn't grow up in a family I had anybody who worked in healthcare. I had no desire to be in healthcare as a high school, college student. I always joke that I majored in crew and minored in American studies. So I did well in college, but really, to be perfectly honest, crew was really my priority when I was in Yale College, and it was the '90s too. So if you didn't, if you weren't in a pre-professional program or weren't going into investment banking or consulting, a lot of us had the good fortune to just follow each other to a major city and find a job. So that was my plan. And when I think about where my story in healthcare really started, it started when I graduated from college. About 2 months after I graduated from Yale, I was diagnosed with ovarian cancer, and I'm clearly fine. But what's interesting about that, using that as the outset of my story of how I got into healthcare, I don't have a trite tale of I had an amazing surgeon or a wonderful connection with a nurse at the bedside that opened my eyes to healthcare. That really wasn't what happened. I think, and I only know this with a retrospective lens now, I think what really happened is I was really faced with my own mortality. And so I just sort of had to decide, what do you want to do? And I hadn't had to answer that question before. And just to sort of speed up a little bit, I decided that I wanted to go to medical school. And the reason why I did that is, as a Yale College student, when we were, tasked with thinking about medicine, that was the option. It was really going to medical school or going into public health. And I will admit that I was very naive. And I entered a post-bac pre-med program at Columbia, and I went through all the pre-med courses. I hated all of them. And I had sort of I didn't think anything more about it. I thought, this is what I'm going to do. This is terrible, but I'll get through it. So in any event, I did it. I finished all the prerequisites, and we had to take a gap year. And so I worked as a research assistant in the integrative medicine department at Memorial Sloan Kettering. And somewhere during all of those years, I also met my now husband, which I think provides a little extra color to the decisions that I made. In any event, it was during my year at Memorial where I really had the opportunity to meet with some really spectacular people who worked in healthcare, and they really challenged me to think about what it is that I want to do. And for many reasons, which would require another webinar, I decided to not take the MCAT and to not go to medical school. And it was really in conversations predominantly with nurse practitioners at Memorial, but it opened my eyes to what I really could do and also have a different lifestyle than I think what at the time I thought a lifestyle going to medical school and beyond might have been. So I applied to a host of accelerated nursing programs and ended up back at Yale. And I entered the accelerated program with a specialty in the pediatric nurse practitioner program. And for people who don't have an undergraduate degree in nursing, you sort of do this rapidly accelerated first-year program. And as somebody who wanted to do adolescent health, doing my first semester of medical surgical nursing in the hospital, I thought I had made a serious misstep. But at that point, I figured I'm just going to press on. And I did, and ended up being a really wonderful 3-year program for me. And from there, I stayed in New Haven and was given the opportunity to have what at the time was a pretty coveted job at a community health center in New Haven, working predominantly with low-income Spanish-speaking patients. And when Cheyenne talked about burnout, that particularly resonated because it didn't take me very long. It was 2 years and I was tired and overworked and wondered how I was going to make a life of this. And my husband, what I joke is sort of like got the rescue job, and we moved to New York City. And so that was sort of my ability to exit that job, which in and of itself was not terrible. It was just really, really hard. So we moved to New York, and at that point, I thought, I don't want to be a nurse practitioner. I can't do this. It's too hard. And I thought maybe the logical side step for me might be to go into public health. So I decided to apply to a doctoral program in New York City in public health. And during the application process, I got a job at the New York City Department of Health, working in the maternal and infant health division, mostly in adolescent healthcare access. And I got rejected from the PhD program. And I can't remember the exact timing of it, but somehow I was working at the health department, and my boss at the time said, I just got an email from one of our grantees at the door, which is an adolescent health center in the city, which is what I had thought I wanted to do. And they're looking for a nurse practitioner. And so I very quickly stopped being depressed about not getting into this doctoral program that I thought was my other parachute. And I ended up taking this position at the door, and it was really, really transformative and wonderful. I worked with an incredible team of physicians and nurse practitioners, and it was really, really amazing. Sometime during that period of my life, I had my first child and returned to work after a traditional 3 or 4 month maternity leave, and kind of went back without really thinking much about it. Time went on, and my husband and I decided that we needed to leave New York City. So we did, and my commute wouldn't have been tenable. So I left that job and had no job, and was back really being a full-time mom. And somebody called me and said, there's this new telehealth company. We'd like you to be a pediatric nurse practitioner, basically on the internet. And so I said, all right, I'll give it a whirl. Again, separate webinar on my thoughts on telehealth and the place for it. But I did that for a couple of years while I was, actually really just a year while I was sort of figuring out what to do, and ended up getting a call from a headhunter for a job at Barnard Student Health Services, which is one of the colleges in New York City. And it ended up being what I thought was going to be the ideal job for me to maintain my life as a nurse practitioner. It was 3 days a week, no call, no weekends, and no summers. And I thought, this is going to be it. I'm really sounding like I don't want to work that hard, but when I get asked about my challenges, I'll tell you it's my work-life balance. So in any event, that was sort of for me my test job. You know, I thought if this is as good as it's going to get for me in terms of all of the things that I love to do as a clinician, and also being a mom. I had a second child at some point who's now almost 5, and the first year was great. I feel like I, got back in it, but I still just was not feeling quite settled with where I was. And I had always had it in the back of my mind that I might go back for my PhD. I had a wonderful mentor at the School of Nursing who I'd been in touch with since I graduated from the master's program. And I just did it. The time was right. And so I took the GRE and I wrote an essay and I went for some interviews and they accepted me. And now I'm surrounded by books on research methods and biostatistics, and I'm really loving it. So I know my time's probably up. I could go on, but that's I guess where I'll stop.
Thank you, Serena. We'll come back to you with questions. And then next on our list is Dr. Ciara Ortiz-Puyos. Yeah?
Hi, how's everyone? Thank you, Cheyenne, so much for having me. I will start off by saying that I think my whole story is framed by knowing who you really are and kind of being true to your core self as you go along your journey. And this opportunity has given me a lot of time to reflect on that. So briefly, I am originally from New York City, first generation Puerto Rican, first person in my entire family to go to college. And my family, both in Puerto Rico and New York, they knew of Yale, but they really didn't know of Yale. They couldn't even really pronounce it. So when I got my acceptance letter, my mom called and she was like, "Hey, my daughter got into Yale." And they're like, "Yale?" So my desire to go into medicine started very young. My first language is Spanish, but I had more English than my mother did. So at the age of 5 or 6 years old, I was doing medical interpretation about things that I had absolutely no concept, like pap smears, preventive health, all these things. And as you can imagine, I probably got a few things wrong. But one of the things that I saw at a very early age was how my mother is a very intelligent woman. Because of circumstance and whole family dynamics, she wasn't allowed to go to college to do anything other than being a teacher. And to see her be disrespected by her doctors was very unsettling to me. So I decided that I wanted to go into medicine so that I can serve my community, so that I can be someone that people who spoke Spanish can say, "I relate to you, you can speak in my language." And so that was kind of what I then made my life plan. I was someone who was very organized. I had a mission and I was gonna stick to it. So I went to TL, and first it was a culture shock as being someone from inner city New York City who went to public school during the 90s when there was a lot of racial tension, and then ending up in a place like Yale was a lot to get used to. I had never met I had barely met people from Long Island, let alone from Idaho, Iowa, or Nebraska. So it was difficult, and I pretty much soon learned that I had to work not only to cover my personal part of the tuition, but my parents. So it was a very busy time at Yale. I was a literature major, pre-med, and working my last semester 4 jobs. So I was go, 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 go. I was very driven, not a lot of personal life. I was like, yeah, I'll have a personal life later. Once I reach my goal, it was always later. It was all about the job. So I took a gap year while I was an undergrad and did a research fellowship at Harvard. It was great. It was fantastic, but I had a hustle. I was allowed to get authorship on a paper, and I would think, this is awesome. I'm going to be 19, 20 years old with authorship on a paper, but I got paid almost nothing. So I was homeless for a little bit of time, couch surfing, then also got a few jobs while I was up at Harvard. But I got second authorship, which was great, and I had that already on my resume, and I'm thinking, okay, I'm a step ahead of the game. However, by the time I graduated, I was sleeping 1 hour a day, which is not healthy. And this kind of goes to that work-life balance. So I said, if I go to medical school sleeping only 1 hour a day, I'm going to burn very quickly. So I decided to take one gap year, which turned into 5 gap years. Where I did a variety of different types of medical consulting in the Washington, D.C. area. 9/11 came. 10 months later, I started medical school. At medical school, I thought I was going to be a pediatric HIV investigator. And then somehow, I fell in love with surgery. I don't know how, but maybe it was a rush. Maybe it was because I thought that as a first person going to college, I needed to do it big, make it big. I mean, don't go for internal medicine, go for surgery. And yes, so it was amazing, but surgery is something that required a lot of sacrifice, and I had already done a lot of sacrifice as it was. But I started general surgery at the University of Rochester, and then I fell in love with burn surgery, and because it kind of pulled on my heartstrings. It was a population that was very vulnerable. It was exactly the population that I wanted to dedicate my life to. Vulnerable populations, people who didn't have a voice. And so I came to North Carolina, where to one of the largest burn centers in the country, and to do a research fellowship, which is common in surgical training, that you do a fellowship some research fellowship so that you can be competitive at the end of your training. And while I was here, I met my to-be husband. He was a Special Forces Green Beret who also came from humble background, and we fell in love, we got engaged, and then a week later he was diagnosed with non-Hodgkin's lymphoma. So our first year, and I was already in my late 30s, so we're like, okay, let's try to have a kid because my eggs are getting dry. So lo and behold, I became pregnant. He went through chemo, radiation, and I did my master's in public health during that time. His last day of radiation, I went into the hospital and gave birth to our daughter. And then I had 10 days of maternity leave and went back to work. 3 months later, went back into surgical training. I transferred programs from Rochester to the University of North Carolina in Chapel Hill so that we could be together and he could continue his cancer treatment. I got an opportunity to go into plastic surgery, so I joined the integrated plastic surgery division. At that point, not only were we dealing with his cancer, but then my mother became very ill with Parkinson's. And because we cannot afford childcare, my daughter was often in New York instead of being with me, so I missed all of her milestones. And I was like, as you say, geriatric mom and probably won't be able to have another child. And I missed everything. I missed her first words, her first steps. And what I was doing from a patient care standpoint was getting further and further away of working with the populations that I wanted to work with, Spanish-speaking, vulnerable patients. Combination of all these life circumstances made me pivot. And although I had 2 years left of plastic surgery, I'm like, this is not for me. My heart is not in this. I need to get back to what really makes me happy, and also would give me a little more time to be with my daughter and also help care for my mom. So I left plastic surgery and I moved to preventive medicine, which is more of a population health specialty, not very well known, not very well understood, but it definitely allows me to have the training to work at a higher level, more of these upstream factors that affect health. And so I've been dedicating the last 2 years to working with Latino populations, working in local health departments, working on obesity, which is a huge problem, and also doing a lot more global health, which is where my heart lies as well. So I've been working in Nicaragua on Zika and looking at the sequelae of what happens to those children who were exposed to the Zika virus in utero during the peak. I'm actually leaving there tomorrow morning, and I'm currently on the job market. I would say it's been a very exciting journey, a very difficult journey to walk away from surgery, to go from a potential salary of over 300 to maybe 100 plus. But happiness you can't put a price tag on happiness. I am scared. I have reservations. I have student loans, but I will be able to be more present in my family, and hopefully it will decrease some of the stresses that have been going on. And so it's hard. There hasn't been a ton of mentorship because people usually don't make these dramatic changes. So I've been forging my way and making some mistakes in the process, which I'll be happy to share later. But I would say, know who you are, be true to yourself, follow your passion, and it will give you the drive to achieve whatever it is that you want, even if it takes longer than you would like. So that's all I have for now.
Thank you, thank you. So next we have Ross, who's here sitting next to me. There you go.
We good?
Yeah, go ahead.
Good. Well, I'm the gender gap. I turned 80 in October.
Yeah.
Okay. None of our panelists were born when I graduated from high school. And Cheyenne wasn't born either. Now, I think we're all influenced by our personalities, our environment, our communities, our opportunities, the time we were born in history. We're all individuals. We all find our own way. I lived in 36 different residencies. It does include a few dorm rooms. I've had 16 jobs. Little background, and then I'll go through my many years of work. I grew up in Lawrence, Massachusetts, which is now famous because Elizabeth Warren chose it to announce her presidency. It's an immigrant town. It's always been an immigrant town. It was built as an immigrant town. It's poor. The immigrants change, but nothing else does. When I graduated from high school, it was a big deal. I was fascinated because nobody went to college. It was 1955. The GI Bill hadn't even come yet. Going to college was a big deal, but being a woman going to college was absurd. You either became a telephone operator, you became a nurse, or you became a teacher. But preferably, you became a wife and mother. And I grew up in the Italian community because my grandparents immigrated at the turn of the century. My mother was orphaned at 3 because both my maternal grandparents died in the 1918 epidemic. So that's kind of where I came from. I grew up in a 3-decker. Do you remember what 3-deckers are? They're tenements. They're walk-up tenements, no central heat, no running hot water, and I did not have a bathtub until I was in high school, let alone a shower. That was unheard of. Nobody had showers. My mother was beautiful. She had an 8th grade education. You should know she lived to 101 in 10 months. And she managed very well. She was beautiful. She was strikingly beautiful. And she was extremely intuitive, but she wasn't very bright, and she had very limited experience. However, she was very responsible, and she had an enormous amount of stamina. And bless her for it, because I got it too. She encouraged me to become a nurse because she thought nurses looked pretty. They wore uniforms, and you know, they patted your head. And most of her information came from movies anyway. But I think she also thought I would go to the local nursing school, which would keep me at home. Now, that was the last thing I wanted to do. I wanted out of there. I wanted to be on my own. But I was, of course, 16 years old because I graduated early, because I started early, because I'm a child of the war. And students, mothers had to go to work because all their fathers were gone. But my mother didn't have a husband because she divorced him when I was 14 months old. 1941, and we were all Catholic. So it was a crazy, crazy beginning. However, Eisenhower, the year I graduated from Eisenhower, had a heart attack. And all the newspapers carried the story that Paul Dudley White was the cardiologist who took care of him. And Paul Dudley White was at MGH, Massachusetts General Hospital. So I thought I should go there. Anyway, I went to Boston. And I was fortunate because I got excellent clinical training. I was told I was the best. We were all the best. Everybody at MGH was the best. They honestly believed that no one else anywhere in the world was as good as they were. Sound like they are? To some extent, that was true at the time. It was the best hospital in the world at the time. And I will tell you that the director of nurses 30 years later told me, now it's one of the best. That's what happened. So humble. I went to nursing school on a scholarship, and I can still remember how much money they gave me. For 3 years, $568. They gave us uniforms, they did our laundry, they fed us, they housed us, and we worked 6 days a week. I did that for the 3 years. At that time, all nursing was in schools, were in hospitals. There were a few, like Yale, where you could get a college degree, but that was not the norm. The norm was hospitals. But MGH was not just any hospital, and they knew, and they conveyed to us, that if you wanted a career in nursing, you should get a college degree. So by the time I had finished my RN diploma, I was already programmed to go forward. But I didn't have any money, and my mother worked in a factory. And we paid $3.50 a week for rent. I remember these really weird tidbits of information, like how much my rent was in New Haven, I'll get to that. So I worked in the emergency room at Mass General Hospital, permanent nights, so I could save money for tuition to college. Because the one thing that wasn't available were federal loans, or much of anything else. And if I worked nights, I got the extra money for working permanent nights, and you had no time to socialize anyway because you only had your afternoons free when everybody else was working. So it worked for me. I decided to go to Columbia University, which had a program at Teachers College for RN diploma graduates to earn their bachelor's degree. It was one of the first in the country. No longer exists. And the reason I chose it, not only because it was a place that a lot of people at MGH had gone, was that they gave you the most credit for your diploma. And I needed to save money, and so the shorter amount of time I had to go to school, the richer I was going to be. That's a joke. So I went to Columbia, but of course I had to pay for room and I had enough money for tuition, but I had to pay room and board and I had to eat. So I worked every weekend. I never had a weekend off in my 2 years at Columbia. I worked at St. Luke's, I worked at Columbia Presbyterian, I worked at Bellevue. I did a stint in Harlem with the Visiting Nurses Service. I worked at Sloan Kettering. Anyone who would hire me, I would work. We called them float nurses at the time. And nursing has always had a shortage, so you never had trouble getting a job. I was very lucky because as a nurse, I could earn a decent wage. You know, I could earn $20 a shift. That's what we earned, $20 a shift. But that was $40 a weekend. No, that was a lot of money. I mean, my credits cost $30 a credit at Columbia. That's how much they charged us, $30 a credit. So Columbia was wonderful. I loved the liberal arts. I had never had that opportunity before. But one of the things I learned at Columbia was that I really liked the educational part. I always liked school. I'm not a very good athlete, so it's good that I like school because I have no athletic ability. And I needed to think about where I wanted to go. At that time, a bachelor's degree in nursing didn't really help you very much if you already had a diploma. It was useful, but it wasn't very helpful. If you wanted to do much else, you needed to get a master's degree. And Columbia was very good at being very clear about that. And so if I wanted to go into education, which I thought was more satisfying because I was good at school, rather than clinical practice, I would need to get a master's degree. So how did I decide on Yale? I once met a Yale woman that I liked. I don't remember her name. I do remember what she looks like. I have no idea. That's it. And so I called Yale and I said, well, I don't want to go through the application process until I come and visit. So they made an appointment for me. I spent 5 hours with Florence Wald and Robert Summers and a woman named Anderson, whose first name I cannot remember. And they made it like, won't you please come here? Which, I mean, that's almost, what else could be more appealing than somebody wanting you, right? So I went to Yale, and at that time, we didn't have nurse practitioners. Now, mind you, at Mass General, we were still opening chests for cardiac arrest. So I come from a different generation. We didn't have nurse practitioners, but we had nurse clinicians. And I chose to be a psychiatric nurse clinician. That's the program that I was in. There were 12 of us in my class at Yale. We all knew each other very well. There were four of us in psych, 2 people in public health, and 6 people in maternal and child health care. Ernestine Wiedenbach, for any of you who are obstetrical people, was still teaching at Yale at that time. And she was the guru of midwives. So it was a very exciting time. We had sherry every Friday afternoon in the evening. There were 12 of us, remember? So we were manageable. At the end of my first year at Yale, I got married to a graduate student. And we lived on Howe Street next to the YMCA for $90 a month. He had a United States Public Health Service Fellowship, and I had a United States Public Health Service Fellowship. He got paid 12 months of the year. I got paid 10 months of the year. He got a $50 stipend when he married me, and I didn't. That's just the way it was. At the time, the Yale program, the only Yale program there was the program to get an MSN designed for bachelor-prepared nurses. Because it was 1961, and Florence Wald had just transitioned from the old MN program, which Whitney Griswold, the president of Yale, had wanted to close, to the new MSN program, which took college graduates. It brought the Yale School of Nursing to be a graduate school in the university. Because before that, the MN program was considered an undergraduate program, and Yale doesn't have undergraduate professional degrees. So I was in that cusp. Besides having the absolute advantage of Florence Wald, who was inspirational, and she's the woman who's responsible for hospice in this country. She started it in Connecticut, and she just made a huge difference. She brought Laura Saunders, who started hospice in England, to Yale. So I sat at a seminar table with the woman who started hospice, who was a nurse before she was a physician. Very important. She thought very important. The other person I had at Yale was Rita Dumas. And Rita Dumas was my mentor. And she remains, I think, the only mentor I had professionally in my life, although I had very many people help me. And I had the good fortune to be the class ahead of Donna Deers, and we were good friends. We used to watch television, Man from Uncle. And I remained good friends with Donna for my life. Because I got married, and my ex-husband at that time was still working on his PhD, and Yale thought I should stay and do research. Clinical practice and nursing research were the two emphases that were in the program. And that was very unusual at the time. Research was never taught in nursing programs. And clinical practice wasn't really important in a master's program because people who were getting their master's degree were thought to be prepared clinically, and so they needed education or administration. But Yale was different. You could do education, administration, in addition to clinician expertise and research. And so it programmed me for the future, if you will. I stayed on a year after I graduated because we got a grant, two of us, from the American Academy of Nursing to do an extension of our master's thesis. And that worked out perfectly because by the time I finished that year, and the important thing of that year is that I got to go to Truman Brewster's inauguration ball because I was on the faculty. I was an instructor, but I was on the faculty. My ex-husband got a job in Dallas, Texas.
Oh.
You got to know, I come from Lawrence, Massachusetts. Dallas, Texas wasn't even on the map. I got 3 job offers because I was from Yale. I got a job offer at Texas Women's University, which is in Dallas, even though the main campus is in Denton. At Baylor, although the main campus is in Houston, and at Texas Christian University in Fort Worth, that had a dean who had run the diploma school in the hospital before it had become the collegiate school on campus. And so she really had an enormous appreciation of the way I had come up in the ranks. And she herself had a personality that encouraged her to mentor people in a very mild way. Whatever I asked for, she gave me. What a wonderful mentor. Now, she was interesting because she didn't marry till she was 72 for the first time. But none of the directors of nursing were married when I was in school. Because if you married, you had to move off campus. And directors and deans were expected to live on campus. Because that's the way it was. Now, that was also true when I went to grade school. Teachers in Massachusetts who got married became temporary help, lost all the benefits. Now, these were people who were the teachers that I had in grade school. These were people from the Depression. They weren't going to get married and give up their jobs. But women are very practical. So I stayed in Dallas for, how many minutes do I have?
Well,
and I'm only halfway there.
I know.
Mine is much longer.
I know. We have a total of 27 minutes to go, but you can take as long as you wish.
Okay, so we were in Dallas for 3 years. We moved to Davis, California because we got a new job. I went to work for I had a baby in Dallas. And I had a baby, and I was pregnant when I left. So I had a baby in Davis when I got there. So I had 2 children. I was in a place that did not have any school of nursing. And so I took 2 years off and stayed home and almost went bananas because I had too much energy for doing what I was doing. And so when my kids went to nursery school, I went to work, half-time, but I went to work. I went to Cal State Sacramento. I taught. I became an interim director of the program there. I taught for an off-campus UCSF program because the research teacher was on sabbatical and they needed somebody to teach research methods. And I was at Cal State for approximately 4 or 5 years. And then the woman from San Francisco named Shirley Chater said to me, you should get your doctorate if you want to stay in nursing education. So I went to Berkeley. And I didn't want to be a student at Davis because I was a faculty wife. And let me tell you, they see you as a faculty wife, they don't see you as in your own right. So I went to Berkeley, I commuted. I was at Berkeley for, it took me 8 years to do my dissertation and my degree, but I was really only there for 3 years. And I commuted on the bus and I had a half-time job at Cal State. So I was pretty busy. It was doable, but I wouldn't recommend it to anybody. Everybody knows what happens when you try to do too much. I then went to Ireland for a year because my ex had a sabbatical, and I did a research study on how people use psychiatric facilities in Ireland, which got published. And I had no money, I just did it, you know. Came back, got a job with the Yolo County Mental Health Association and did a drug treatment study for 3 years. And at that point, decided I needed to do my doctorate. So I finished it. At the same time, I went to work for the California legislature, and this is similar to you. I didn't know anything about the legislature. I knew a lot about higher education because I was in a program at Berkeley for higher education administration and policy. And so I could do that, you know. I learned a lot. I spent 5 years with the higher ed committee and then the Ways and Means committee. You follow your boss. My boss went from one committee to another. I went from one committee to another. And then I got divorced. No, I guess I didn't get divorced. I went to Boston. I went to Boston to set up the Massachusetts Institute of Health Professions that MGH started because they had to close their school of nursing. And that was a recommendation from Donna Deers. Donna thought I should go. The way they wanted to structure their program was on the old Yale model of the college graduate getting a master's in the science of nursing with a clinical major. So I set that up, spent 3 years there, realized I didn't want to stay there for many, many reasons. My family hated Massachusetts. And so we came back to Davis and I went, and that was the cleavage between healthcare and higher education. I went to work for the California Post-Secondary Education Commission because the man who was the director had worked with me when I was in the legislature and thought I could do, would you believe, health sciences investigations from the California Post-Secondary Education Commission. So I was still in healthcare, but I was really in research. While I was there, I was recruited to Berkeley by the chancellor, who thought he wanted me on the campus, that I had a lot of skills he could use. So I worked on the Berkeley campus for 5 years as an assistant vice chancellor for academic affairs, and had wonderful experiences. Was responsible for sexual harassment, a lot of building projects. I was the liaison from academic affairs. I did a huge amount of work with faculty discipline. All of my nursing and psychiatric skills were used. I'm trying to think what, oh, my boss retired when he did not become chancellor. And so I had a new boss whom I really didn't like his personality. He was very well respected and he was brilliant, but he wasn't fun to work with. And when I got offered a job at the University of Northern Colorado, I decided to take it. I became the vice president for academic affairs. And I was only there for 2 years because I worked for a borderline psychotic. And you can't change that. So, and I'm not done. And when it became clear to me, that there was nowhere to go and no one to go to, I sat down and made a list of 30 people and called them and said, I need a job. And I had a job in 7 weeks. I went back to Massachusetts, where I became the vice chancellor for the higher ed board, and had the best office I've ever had. I had a 24-story corner window looking out over Boston. It was magnificent. But at the same time that I did that, I reconnected with an old friend from my early days, and he thought I should marry him. So, he was 63 and I was 56. And so we did get married, and we lived commuting from Portland to Boston for a year. And then he said, you know, married people should live together. Old-fashioned idea, that is. And so I came to Portland when I got a job. There were only 2 jobs available when I came here, and one of them I didn't get. So the other one was to be the Associate Vice President for Academic Affairs at OHSU, which I did for 5 years. And at 62, I retired, and I did a consulting job for KPMG doing headhunting for the University of California at Merced, where I was instrumental in the initial hiring of all of the administrators there. And since then, I have learned to quilt, make beads, knit, and do all kinds of wonderful things I never got to do. I have a Yale daughter. I have a Yale son-in-law. And I have a Berkeley daughter. And I have a Marine. And I've had a very good life. My 3 things, like my fellow panelists, you got to be honest with yourself. You got to try things. You have to work hard at them. But not everything's under your control. And if you can't get it so that you like going to work in the morning, you don't belong there. The other is rely on your friends. My friends have been the bane of my existence. Now, I have to tell you, I don't have family. I only had my mother. I never knew my father until I was an adult. And so I had to make friends. And I wasn't very likable at the university. That was really hard work. No athletic skills, no friends. It was very difficult. I've overcome both. And the last thing is nothing is permanent but death. So truck on.
Thank you very much. So now I'd like to open to questions from the on-site or online audience. I had some questions for the panelists, but we have 17 minutes, so I'm sure you guys have questions for these amazing women. Or maybe you don't. Okay, so we have. Okay. All right. Go ahead.
Hi. Yeah, my name's Joy. I'm just finishing up my DMP, and I had a question for Serena.
Maybe speak louder, Simon?
Oh, yeah. I had a question for Serena or anyone who's balancing this element of clinical and the academic and kind of process improvement elements. And I know they pushed this program initially for empowering more people to get into, academia as instructors. But I'm wondering, when you are in the clinical environment, do you feel like there's more and more opportunities for process improvement that are encouraged, or do you feel like you are primarily put in the role as a clinician with direct patient care?
I can go ahead. I'm sorry, you're cutting in and out a little bit, but am I right that you're kind of the essence of your question is, how much room to grow is there in a clinical setting as a nurse practitioner?
Yeah, and if you feel like NPs are starting to be encouraged to take on a role more in process improvement in the clinical environment.
Well, in my experiences, I feel as if where I have worked, and this is probably what has largely propelled me to do what I'm doing now, I didn't see the role for the nurse practitioner in whatever it was, clinical management, operations. And again, I've worked largely in community health centers. So they tend, it tends to be professionals who have much more experience either in medicine as physicians or who have, degrees in health policy or in public health. And that was something that I wrestled with. And I think, however long ago it was, 10 years ago when I thought about doing a PhD program in public health, to me that felt like sort of a lateral move for me to begin to be able to get out of direct clinical practice, because I just sort of couldn't see the light. So I don't know, others may have different experiences, but I don't see it. And again, I've also only worked on the East Coast, so I don't know if it's, if there's some geographical influence at all, but I have never worked in a place where I saw an opportunity for me to be anything other than a nurse practitioner. And again, not that that's a bad thing. I've been so happy being a clinical NP for so many years. But when you take a step back and think about personal growth and opportunity and, continuing to learn, anybody who's a clinician knows that certainly you're learning, every day from your colleagues and from your patients. And there's always growth, but there does come a point where like the growth starts to slow down a little bit. Just in terms of, you don't see that many different things all the time in clinical medicine. So that's my best answer to that question.
Great, thank you. I think Dani probably can answer because you work in big systems.
I would say, no, there isn't. From what I've seen, what I've experienced, and friends that actually were more clinical nurse practitioners. So as I mentioned before, what I encountered is like, when you try and move into different realms, there's those lanes defined, right?
Yeah.
By recruiters or leaders who've been in healthcare for quite a while. And so it is challenging to break out of those lanes. It's like, well, they see you and maybe get more clinical based, but you are a process improvement. I think everyone has the ability about like what you're studying, what you're doing to change it. And so I think those positions, there's opportunity for them in the future. And so I would encourage you, if that's your passion, or there's things that you're like, I think we can do this, to go after and start to create that action. and even pose the opportunities for positions in healthcare. I think they're needed, but I just, in the layers of administration that I worked in different health systems, I haven't seen it yet as much.
But I can speak a little bit to that because for the first 10 years of my clinical practice, I started getting a feeling, I got this, I want more challenges, how do I do that? So I started doing projects in terms of quality improvement, performance measurement, payment reform. I define the projects very distinctly so that I can package it, I can write about it. And then after a few years of that, I went and got a degree in Master's of Healthcare Management. So while I was working. So while you cannot count on the degree to change what you do and who you are, the degree can be a pivot point along the path that you have been working on. So since my degree, I still do what I do, but I'm much better at leading projects, thinking big, and being recognized and being given the opportunity. So that's how I navigated while still kind of holding on to my clinical job. But you could do more of how these women have done is a more distinct transition. So I'm trying to point out in this conference is there are different ways of making the transition. My way is probably more risk averse, more safe, but it also limits me, right? I can only add on so much to what I'm doing. There's a ceiling to that. So those are just different ways. We have some online questions. So Lisa Chapman wanted to ask about how do you overcome the imposter syndrome? Or maybe you don't even have that. I have that. How about, do you guys know what I'm talking about, right?
Sure.
So, thoughts?
Well, none of us know how to do anything that we've never done before. And so, what do you risk? I think people get very concerned about what they will lose if they try something different. And that's important to face because it's a comfort zone, but nobody feels secure. I mean, I have a daughter who's a university professor. She told me this weekend something I never knew. Now, she's 52 years old. That she has to work at being an extrovert. You would never know that. But I understand it because I went through it myself. I wasn't always who I am today. My best quote here is, Margaret Mead said she needed a husband for each stage of her life, so she had 5. We have stages of our lives. We're not the same people. I'm a good Freudian because I grew up in that era. Your life does not finish at 5. It doesn't finish at 8. It doesn't finish at 80. Right. It doesn't finish. Everything you experience adds to who you are. So take a risk. Now, pay attention because, you do want to eat tomorrow. It's not good to quit a job till you have another job. But some people can do that. I had the advantage that at least for part of my career, I did have a working husband. So I could make some choices that maybe women who couldn't. But I was single for 10 years and I made my way. It was really quite good. And when I think about it, for a long time, I made more money than my first husband. So, I didn't need him to support me, at least not financially. So I would just say to people, what is it you're afraid of losing? If you face what you're afraid of losing, you can get what you want.
Shiara, do you have comments?
Yeah, so I would echo everything you said, Roz. I think for me, I was always afraid of what will people say. Am I going to disappoint those in my family? to disappoint everyone, and I was burnt out. And I kept on chugging along thinking that I would be disappointing anyone. And the only one who ended up losing was me, because I became more and more burnt out. I became less present in my relationships. And quite honestly, I'm going through a divorce right now because I was not there for my husband the way a partner should be. And, but I was afraid, and that was what held me back. And now it's hard to do. I mean, it costs me every day, but I'm moving forward, and I hope I'm following my passion, and that will allow me to be a better person, a better mother, a better physician, just a better human being, and be able to have richer relationships with everyone that I interact with.
Thank you. And then we have another online question from Rob Greenlee. What's the one piece of career advice you'd give to those starting their career today?
Well, I kind of live with the mantra, like, nothing's impossible, right? Like, as it's been mentioned many times before, finding out your passion and carve things into whatever that defined role is and create. So I just encourage people, like, nothing's impossible. It's not that. Who knows where we'll be in 20 years from now, 30 years. And so don't get discouraged, but just, like, make the most opportunity. True. Your relationships that are in that moment, side projects that may come up. So just being open and open to what comes your way as you enter into different careers. And the fact is like, where you think you'll be 5 years from now, every time I've been in interviews, people ask me, where are you going to be 5 years from now? I wouldn't have said where I am today is where I was going to be 5 years ago. And additionally, the same thing another 5 years before that. So just start moving there. Start to understand what fits you better. But being stagnant can be really just passion.
Start moving, get open. Serena.
I would echo those sentiments, and I think the only thing that I would add is you have to have your eyes open to opportunities, because the opportunities come, but if you're not paying attention, you really can miss them. The other thing that I would just say, similar to Dani, I never would have predicted that I am doing what I'm doing at any juncture. Not even 5 years ago, but probably, even just 1 or 2 years ago. And I think largely for me, that's really been a function of the mentors that I've had along the way. And if I were to think kind of more formally about if I could restructure my career in the way that I did it, I would have been a lot more active in seeking out mentors. I've had really one in the nursing profession who has been my champion from the time I was a master's student, and I'm back with her as an advisee now. But I wish that I'd had the opportunity to have accessed more mentors for me, specifically within nursing, because as I alluded to earlier, and there's just no delicate way to say this, but I guess as a nurse I can say this. It took me a long time to be comfortable with really reconciling my professional identity as a nurse, because it was not something that my family or my friends understood or frankly really supported. They weren't negative about it, but they just didn't understand the role of a nurse practitioner. And so I think if I had had more support along the way from a variety of mentors to really encourage me along the path that ultimately was really the right choice for me, but I didn't know, really until like last year, I can say that it took me until about last year to be able to say, I made the right choice and I'm doing the right thing. And I think if I'd had the opportunity to have more mentoring opportunities and access, it really would have changed the way I felt. It wouldn't have changed my trajectory, I don't think, but it would have changed the way I felt along the way.
Great. So seek out mentors. Tiara, actually, Lisa Chapman online asked another question that you might be best to answer. So what advice would you give to our first-gen underserved Yale College students now representing 18% of the class of 2022 for many who say they want to become a doctor? How would you suggest to broaden their thought process and experience?
You have to be open. I remember when I arrived on the Yale campus, I thought that I was bad. I thought that I was on the top of my game. And I knew everything because I came from New York City and I had endured some adversity. And that attitude kind of closed me off a little bit in the first year to really meeting some amazing people. And so you need to be open to putting yourself in potentially uncomfortable places because they're unfamiliar to you. So you have to explore the unfamiliar because that will just broaden your experiences. You know, do something that you would never do. Talk to someone that you would never talk to otherwise. Do things. I know finances are always difficult because they were for me, and I still struggle with that. But if there's an amazing opportunity that will open your eyes to different things, do it. There are ways of making things happen, and so and don't be afraid. Don't let anyone say that you can't. Because I did hear that a lot, and I think that sometimes delayed things. If you really want to do something, you'll find the way, but you have to find mentors, you have to network, you have to put yourself out there. Even if you are an introvert like I am, you gotta put yourself in uncomfortable waters in order to make yourself grow as an individual and as a professional.
Great. Maybe some last piece of advice for us, Rod.
Well, you know, it's so easy when you've been through so many different things, you know, to say, well, if I'd done this or I'd done that. I made a lot of mistakes. I mean, a huge number of mistakes. I can probably relate most of them to you. You know, the things you do wrong stay with you a lot longer than the things you do right, which is stupid attitude. I mean, you know, the thing I am most proud of that I gave my children, my two daughters, the ability to do whatever they want. I have a university professor daughter who is extremely accomplished, and I have a stay-at-home mom. And they are both satisfied with their choices. I didn't have those choices. I worked out the best I could. You know, I didn't feel I had a lot of options at the beginning. I really got channeled. If I had my way, I think I would have been an actress. I have no idea. I did take acting courses at Berkeley, and I did perform at the University of Northern Colorado. I really liked it. But, you know, it's a career. It's not something you stop in and out of. And so, but I didn't have that option. Nobody would become an artist in a working class neighborhood where, you know, people had to make a living. So I would say, and the other thing I really do believe is, nothing is permanent. If you try something and you don't like it, decide how you want to do something else. And you don't have to do it rapidly. You can plan. It took me 10 years to get out of my first marriage.
And now you have Donald.
And now I have my second one. I'm not letting him go.
That's you.
You're gonna make a lot of mistakes, and you're gonna wish things were different. Keep your expectations in front of you, and then revise them.
All right. Do we have last-minute comments from the audience, speakers? Would people want to stay in touch? Do you want me to share your emails with each other, or would you rather not? If you don't, please email me so that you can opt out. If you would like to stay in touch, I could create this group email. I'll share the video recording of this, and you could connect to each other and ask more, detailed questions. So I'll wait for a few days for you guys to opt out if you wish. And then those of us on site, we could still mingle, have more bagel, and thank you to Akiko for getting that. And thank you everyone online. It's precious time on the weekend. I thank particularly our speakers, Dani, Serena, Chiara, and Ross. And I thank everybody else for participating.
Thanks for organizing.
Thank you.
Bye. Bye.
Bye.